What is anxiety? You may have experienced or have heard of someone who has experienced anxiety before. Anxiety is when one feels apprehensive or concerned about an event that might happen. For some, they may feel worried or fearful when thinking about future-oriented events, like sitting for a test or an upcoming interview. Even though they face no real danger in the present moment, they may have worries about these events, like, what if I fail the driving test? Or what if I say the wrong thing in my speech? These feelings are common and normal before such events. However, some individuals may experience it quite intensely. It may be difficult for them to get out of these worries, and their anxiety can often affect their daily functioning. Overwhelmed with the threats of a future danger, these feelings may be excessive, irrational, and also cause significant distress or impairments. In such cases, these individuals may have an anxiety disorder. In this video, we are going to talk about the different types of anxiety disorders, what happens in anxiety therapy, and some tips to help you to cope with anxiety. These are some of the anxiety disorders that are classified in the DSM-5. Panic disorder. Panic disorder is an anxiety disorder in which a person experiences recurrent panic attacks. You may develop an intense fear of and have excessive worries about having another panic attack. Social anxiety disorder. Social anxiety disorder is characterized by extreme fear of social situations. If you experience social anxiety, you may feel an extreme fear of criticism and scrutiny by others in social interactions. This intense fear often leads to an avoidance of the social situation and can cause impairments in school, work, or relationships. Generalized anxiety disorder. Generalized anxiety disorder is diagnosed when an individual experiences persistent worry about everyday challenges out of proportion to the perceived threat. People with GED usually experience excessive fear that can last from a few months to even years. Specific phobias. Specific phobia is a strong and persistent fear of a specific object, person, or situation. You are likely to experience a fear response that is similar to a panic attack when exposed to these objects or situations. What does anxiety look like in the everyday life? Everyone experiences anxiety differently, and it could manifest in various aspects of one's life. Overwhelming levels of fear and anxiety could be observed through behavior. To list a few examples, some common signs of anxiety are excessive worry that is hard to control, sleep disturbances, and constantly feeling on edge. Anxiety could also cause other physical and behavioral symptoms as shown here. Feelings of anxiety could significantly affect your day-to-day. As an individual with fears of getting into an accident, you might avoid driving or even taking public transport and opt to stay in to avoid traveling far. Alternatively, a mother with excessive fear of her child getting hurt might prevent the child from getting out of the house. These cases of anxiety and fear affect the daily activities and functioning, and in these instances, seeing a counselor or psychotherapist may be helpful. When should I go for anxiety therapy? If you're experiencing a lot of worries and anxieties, it does not necessarily mean that you have an anxiety disorder. However, if you experience anxiety that interferes with or affects your daily activities and relationship with others, experience an inability to achieve important goals due to anxiety, avoiding social situations like work or school, extreme biological responses, you should consider going for counseling and psychotherapy. What happens in anxiety therapy? During the initial session, your counselor or psychotherapist will spend time understanding your life history, such as going through your family background, work or school environment, and relationships. Your counselor will also ask questions to understand more about your anxiety and the background of your struggles with anxiety. This is called the intake assessment, which allows the counselor to be better able to understand the nature of your anxiety and plan the most suitable treatment plan for you. Through the process of therapy, your counselor will work with you to uncover the causes of your worries and fears and teach you new skills for relaxation, coping, and problem solving. Common treatment approaches for anxiety include cognitive behavioral therapy, CBT, which focuses on addressing your negative thoughts and reinforcing supportive thoughts. Another common approach is exposure therapy, which is especially helpful for specific phobias. Your therapist may suggest graduated exposure to feared cues, objects, or situations. This could look like first taking a bus for one stop, then 2, taking it to multiple stops, then gradually taking the bus for the whole journey. Your therapist will also equip you with the necessary skills like deep breathing or grounding techniques to help you navigate the situation better. How do you prepare for therapy? The first session of therapy can be daunting. Here are some ways that you can prepare yourself for the first session. First, set clear, realistic goals. Before your first session, it could be helpful if you're clear on what you hope to achieve from the treatment sessions. Think about what motivated you to seek therapy, what are the things that are concerning you, and what you would like to achieve from the sessions. Remember, there are no wrong or right goals. Everyone's experiences are different and personal. Writing a list of talking points that you may want to achieve from the session could also help ease any nervousness. Some topics could include the challenges that you're currently facing, any major life changes, or anything that you've tried previously to help you to feel better. If you have sought therapy before, it could also be helpful for you to think about what you liked about your previous experiences and how that has helped you. At the same time, it could also be valuable to think about the aspects that did not work and discuss it candidly with your therapist. However, if you're still unsure about what you hope to achieve, don't worry. So that's what the intake session is for. Your counselor will help you through the process and help you to set realistic expectations to facilitate your treatment. The next tip is to plan your schedule. When you're planning to schedule your first session, you may want to consider when is the most convenient time slot for you. Sometimes a therapy session could take up a lot of energy. One tip is to plan your sessions on days whereby you have more time to yourself, so consider how you might feel when scheduling your session. Maybe having some time before your session to prepare for the session, or reserving time after your session to reflect may be helpful for you. For example, you may want to arrive early and practice deep breathing or other relaxation exercises to reduce the stress that you may feel before the session. After the session, you may also want to spend some time by yourself to journal or review some of the takeaways that you have had from the session itself. Lastly, be gentle on yourself. Most importantly, give yourself credit for making the decision to seek help. It takes great courage for making the first step to see a professional. It is normal to feel apprehensive, nervous, or excited about your first session. If you feel overwhelmed about coming in for your first session, mention it to your therapist to help manage these feelings and help to refocus on the therapy. Here are some tips for coping with anxiety. Keep physically active. Exercising is helpful in helping to relieve stress, improve mood, and stay healthy. Developing a routine and starting it out slow could be helpful. Number 2, keep a good sleep hygiene and try to get enough sleep to feel rested. Number 3, Avoid alcohol and recreational drugs, as these substances can cause or worsen anxiety. Cutting down nicotine and caffeine intake may help alleviate anxiety too. Identify triggers of your anxiety by keeping track of your personal life. This could be very helpful information for you to share with your therapist during treatment so that you can develop a comprehensive plan to deal with these anxious feelings during these situations. So you may find it helpful to keep a journal. Lastly, involve your support system in your treatment, as they could be a big help towards helping you manage your anxiety. I hope that you found some useful information about dealing with anxiety. If you would like more mental health related content, you can check out our social media channels or visit our website at www.sophia.com.sg. Thank you and see you again.